যদি বিশ্বের কথাও চিন্তা করি, নিউমোনিয়া এখনো সবচেয়ে বেশি শিশুর মৃত্যু ঘটায়। যেগুলো সবই টিকা দ্বারা প্রতিরোধযোগ্য, কিন্তু তারপরেও তারা মারা যাচ্ছে। এবং আমাদের
Advocating the value of HIV vaccine in developing countries was vital to catalysing policy change.
I want to do this advocacy because I want to get this vaccine in this country, not after 2 decades. We want these vaccines to this country, to the children who cannot pay for it at real time.
The HIB initiative had worked to support and help collate disease burden data, but that data needed to be communicated effectively.
You're doing research for a purpose, and if you can't take those messages out there and communicate them to those who you can use them, there's no point in that research.
It's not enough to publishing a paper in the peer-reviewed journals because those papers are remaining only in the scientific journals. So I thought it's better to go for advocacy, and they will be translating that scientific information to public policy.
The HIB initiative identified in-country advocates that could deliver messages that were always evidence-based and tailored to specific audiences.
Sometimes it takes somebody locally that's experienced these diseases, has seen the devastation with families, to be able to explain what the value is of bringing these vaccines sooner rather than later.
Training workshops to develop advocacy skills helped local advocates to think strategically and equip them with materials and know-how to engage a variety of stakeholders, from journalists to policymakers.
It was very important for us to do training for advocacy because this doesn't come very easily, and to help these advocates from the country actually reach their full potential and be as effective as possible.
Many times the materials that we provided them were made much, much better by the local advocates. They came up with some wonderful ideas that really helped explain things in a flavor that was local and really made a difference.
Workshops also provided an opportunity for advocates to share experiences and brainstorm ideas.
One of the most successful exercises was a 30-second hallway talk. Advocates had to think about what was that 30-second message that is going to drive a policymaker to a decision regarding HIV vaccine.
Advocates were also able to apply for small grants for an advocacy program within their country, which encouraged activities ranging from stakeholder meetings to creative grassroots-level programs.
So what I did was to use that grant to get some souvenirs, which were distributed to the people who attended the seminar. So with multiple efforts, I think a lot more people got to know about the importance of HIV.
The HIB initiative and its partners learnt important lessons about the uses and limitations of media.
After the workshop, I had more frequent contact with the press, and then I explored other ways of spreading the news about the importance of HIV vaccines in reducing morbidity and mortality in under 5 children in Nigeria.
It's very important to train health professionals in how to handle media, how you simplify your message, how you focus your message, how you target your message to the right audience.
Media has a time and a place. It can be very effective at presenting the human face of disease and putting a bit of urgency behind decisions. But also keep in mind that it can backfire, and it has for us. So we've had to think about the other channels of communication, like going direct to pediatricians or other technical audiences to make sure that we get our messages across.
The HIB initiative's in-country outreach programme enabled it to sustain political will, even through the challenge of changes in government.
The one thing that helps there, which is much more stable, is your relationship with the professional community. The pediatricians, especially the pediatricians, and working with them continuously during this period basically ensured that we always had a stable group of people who understood the issues and were able to communicate with whatever government manager came into place.
The success of the HIB initiative in turning an unknown disease into an important healthcare priority could not have been achieved without the efforts of respected advocates.
I think that we did not work hard enough as a group globally as well as nationally when HIB vaccine came out. We didn't understand the role of advocacy. We didn't understand that you have to market yourself, you have to market these vaccines. And I think we've learned a lot from the HIB experience to do things better.
The HIB initiative has shown that evidence-informed advocacy is an important skill set to be further developed and expanded to ensure that countries appreciate the urgency and importance of solutions that can start saving lives today. Trained advocates are an invaluable asset to help achieve that goal.